Hello, my name is Haley Faulkner. I'm a student nurse with Chamberlain, and I'm going to be doing a newborn assessment. Okay, so I'm going to start my assessment. I would have done an APGAR score at 1 minute, 5 minutes, and 10 minutes, and I also would start with vital signs on my baby. So I'm going to start by looking at the head. Well, actually, I would wash my hands and put gloves on. And then I'm going to look at the baby's head after I've identified who this baby is. Make sure it's the right one. I'm going to look at the sutures, and I'm also going to look at the fontanelles. The anterior fontanelle should be a diamond shape, and the posterior fontanelle should be a triangle shape. I'm going to look at the baby's hair and make sure it's soft and silky and normally distributed. I'm also going to check the head circumference if I had a measuring tape. I'll look at the ears. We're going to make sure that the top of the ears is in line with the outer canthus, so we can check for Down syndrome. I'm also going to look at the ears in general and make sure there's no abnormalities, because that could be linked to kidney abnormalities since they're developed at the same stage gestationally. I'm going to check the baby's hearing, make sure that they can respond or notice a high-pitched sound. I can also clap and see if they notice that one. I can look at the baby's eyes and open them to make sure they check or that they constrict to light. I don't need to shine a pen light in for a baby. I'm going to check for discharge and abnormalities. This baby's eyes look pretty good. So I'm going to check the nose, because the babies are obligate nose breathers. Check for patency. This baby's nose is patent. I will check the mouth. First I'm looking in, checking the hard and soft palate, and then I'll put my finger in the baby's mouth, feel the gum line and the hard and soft palate. Everything should be pink in the baby's mouth. Check for Epstein pearls and whatnot. This baby doesn't have any. It's good. I'll check the sucking reflex by putting my finger in the baby's mouth, and the baby should begin to suck on my finger. So I'm going to unwrap my baby, unswaddle my baby. And I'm going to check the neck range of motion. I'm going to turn the baby's head, check for crepitus. I could also check the tonic neck reflex right now, so I could turn the baby's head to the right, and this side should extend, and the opposite side should flex. And then same thing if I turn the baby's head to the left side should extend, and the right side should flex. There was no crepitus when I did that. The color of the baby is pink. There's no acrocyanosis. It looks good. I can check the baby's clavicles, check for crepitus, make sure they weren't fractured during delivery. The baby's abdomen is cylinder, or chest is cylinder. The nipples are in line, and there's no witch's milk or inflammation or swelling and whatnot. There's only 2 nipples. He's good to go there. We check the baby's lung sounds with my pediatric or neonatal stethoscope. Okay, so it's normal to hear crackles in a baby who was born with a natural vaginal birth. Baby's respirations, if I listened for a minute, would be between 30 and 60 respirations. And we listened to the heart sounds between the 3rd and 4th intercostal space on the left side. And it should be between 120 and 160. I could also check the chest circumference right now as well. Check the abdomen, make sure it's soft, non-distended. This baby's abdomen soft and non-distended. I can check the umbilical cord to make sure that there's 3 vessels and that it's drying nicely and that the clamp is still intact. I could also palpate the liver on the right side, 2 centimeters below the costal margin, and I can palpate kidneys, whatnot, check those organs to make sure they're not enlarged. I'll check the range of motion and the upper extremities, check for crepitus, make sure they move around pretty well. I can make sure that they're even, that they move well. And check the lower extremities, make sure that they move well and are also even, and there's no hip dysplasia. Check the palmar reflex. The baby, when I put my hand in the baby's palm, they should curl in on both sides. And then I can also check the plantar reflex with the toes as well. I'll check that the hands have 2 transverse creases and that there's 5 fingers, there's no webbing, no extra or missing fingers. And then I'll check the capillary refill to make sure that is normal. Should be about 3 seconds, both sides. I'll check the brachial pulses to make sure that they're even and present. This babies are even and present, and so are the femoral pulses. I'll check the genitalia. This baby right now is a female baby. And I will check to make sure that the baby has a labia majora, labia minora, clitoris, vaginal opening, that the hymen's intact. Everything looks good for this baby. I will turn my baby over, supporting the head, and check the spine. This baby has no spina bifida present. There's no like Mongolian spots or anything, and the baby's anus is patent. I can move on and do some of my reflexes. I'll check the Babinski reflex, go on the lateral side in towards the toes. Same thing, lateral side up and in towards the toes, and the baby's toes should curl out and spread out. I'll check the rooting reflex by moving my finger on the baby's cheek, and the baby should turn its head in response to getting fed. I will check the stepping reflex, so I'm going to support the baby's head, and the baby's lower extremities should move like they're stepping when you hold them up like this. We already checked the tonic reflex when I did the upper portion of my assessment, but I can also do the moral reflex. I can either startle the baby, or I can do it by not supporting their head and letting it drop back by 30 degrees. The baby should begin crying. Yeah, that is my newborn assessment. My baby appears to be well. I would monitor for like input or intake and output. We want to make sure we see that first void, urine and feces.